everyone. We're glad that you're here today, and I thought we might just go ahead and get started if we could. I'm Dennis Newkirk. I'm the senior pastor here at Henderson Hills, and it's my joy to have you come today. We've been told of how Integris Health has, through the years, been good neighbors in their communities. They have done this by helping the poor, they are strengthening education, and they're improving the cities in which they're located. And so we are in hopes that a wonderful synergy can be developed between Henderson Hills and our Ministries of Jesus Clinic and the Integris Health System, and particularly the hospital that may one day come here. The decision on whether to accept the offer by Integris is now in the hands of our congregation and their understanding of the Lord's leadership. And I have every reason to believe that they're going to make a great decision this coming weekend. And if it's the Lord's will, we look forward to years of cooperation between Henderson Hills and, again, our Ministries of Jesus Clinic and the good friends that we're developing at Integris Hospital. And so with that being said, I'd like to introduce to you someone who probably needs almost no introduction to you, Mr. Stan Huff, who's the President and CEO of Integris Health.
Thank you, Dennis, and good afternoon. It is interesting that in 1909, in Enid, Oklahoma, the very first Baptist hospital was built by a group of concerned citizens and physicians, just a little bit after we achieved statehood. And then that was followed in 1919 in Miami with another Baptist hospital. So the Baptist Church in this state has a long history of providing healthcare services across the state. Integris is the natural survivor of those institutions. And so it is very fitting that today we embark upon a great journey of building a hospital in Edmond. The fastest growing community in Oklahoma, one of the most dynamic communities in Oklahoma, well led by a very fine city council and mayor, with a dynamic economic base. We could not be more pleased than to be here. We're especially pleased because, as Dennis said, we do have a mission which says we're here to make a difference in people's health. And that is, we want to improve their lives. And we know that improving their lives has something to do with running good hospitals. But it has just as much to do with where people live and what they had to eat today and what their educational level is. And so, as Dennis has indicated, and I think is in your press packet, we have a long history of trying to make a real difference in our communities, whether that's operating a charter school for the underprivileged as the only corporate identity in the state of Oklahoma to operate a charter school, whether that's to operate gang programs, or whether that is to operate free clinics. We feel very personally that we have a responsibility to be a good corporate citizen and to give back and to extend the healing of Jesus Christ out into our communities. So we take this opportunity to partner with the Henderson Hills Baptist Church very, very seriously. We're delighted with this opportunity. We do not presume. We know that the congregation has to vote, and we're hopeful that they will endorse our opportunity here. We also know that the Edmond City leadership and their planning commission have to approve our plans, and so we are knowledgeable of that and expect that we'll have great cooperation there. But at the end of the day, it is our hope that if everything goes well, that we could be turning dirt within a year, which means that a year and a half later, we'll have a brand new hospital on this site. And that's exciting to us. It's exciting as the largest provider of health services in Oklahoma. It's exciting to us as of all the major hospital systems in this state to be one of the few that is based in Oklahoma. Everybody that has anything to do with our organization has an Oklahoma address, and we take that with a great deal of pride. So we're embarking on something that's exciting for us. that we look forward to seeing all of you back here in a year or so, a couple of years, and certainly, hopefully within the year where we do the groundbreaking, and then a year and a half later where we open our facility to the citizens of Edmond. We are delighted to be able to work with Henderson Hills. It is a church with great leadership and a wonderful reputation, and we think we're going to have a great partnership. And speaking of partners, I'm very pleased to introduce the mayor of Edmond. He and I have a lot in common, not the least of which is serving in Vietnam at about the same time. We've struck a real good friendship. And I'm very impressed with the city leadership of Edmond, their farsightedness, their focus on quality, their insistence on doing the right thing for the right reason. And so we could not be more pleased to have the opportunity to be in their community. And Mayor ONeill. Mayor?
Community cannot be anything but excited about the opportunity to add to our hospital in this very positive way. The presence of Integris Health is a result of the growing healthcare needs of the city of Edmond and the surrounding areas. We were talking about perspective earlier, and I couldn't help but think about the first Edmond City Hospital was downtown, right next to the movie house downtown. And what a wonderful progress our community has made, and what a wonderful addition this particular hospital will be to the healthcare facilities in our community. The announcement of this facility along the I-35 corridor is especially something that makes me proud, because it is a substantial addition to the quality development happening all over Edmond, and especially along the interstate. The plans for this Integris Health Hospital incorporate the individual and unique surroundings of Lake Arcadia, and they also incorporate the unique and surrounding facility here at the Henderson Hill Baptist Church. Combining the capital investment along with the estimated payroll, we think the economic and real positive impact of this project could reach $140 million for the community. That is a phenomenal contribution to our community, and we appreciate that investment, sir. This new facility could potentially generate an indirect impact of several 100,000 square feet of non-residential development and several hundred indirect jobs. We look forward to a solid working relationship with the leadership of Integris Health, and we promote this partnership. Thank you, Nick. I would like to introduce the Executive Director for the Henderson Hills Baptist Church, Kim Swiden. Kim?
My part gets to be the director if you have questions. We would like to take this time to answer questions. Obviously, if you have questions with respect to Integris Hospital, we'll ask Mr. Feld to answer those, or with respect to the city, our mayor can answer those, or Henderson Hill would ask Pastor Newkirk questions with respect to the actual real estate transaction. I'll try to field those. So, are there questions?
When is the very earliest that you would expect this hospital to open?
Mr. Huff.
If we're successful and with all the planning and the regulatory approval through the City Planning Commission, we could be turning dirt, I said, within a year. So that would be 6 months going through the planning process, then the architectural plans. So if we're turning dirt a year from now, then you can expect a year and a half, 18 months to 20 months construction time. So I think that puts us somewhere around 2010 for an opening.
What the size of the hospital, number of beds, doctors?
Right now, we're speculating that it's between 30 and 60. And that's probably about the right size. The property that you see here, the 24.5 acres that hopefully we will purchase from Henderson Hills, will be added to another 20 acres that we'll also acquire. And so that will give us almost 45 acres, which will allow significant expansion opportunity over the years. I was just telling someone else that Baptist Medical Center itself, our flagship hospital, is on 40 acres. So you can build an awful lot of hospital on that kind of site. So we think to start with 30 to 60 is a good number that allows us to have a nice inpatient facility, a surgical suite, obstetrics, probably an ICU, and then depending on how we can grow and physicians that we could attract to this community, then we could expand it over time. That's the ideal situation. There's a real synergy that exists between the facility and being able to recruit doctors, and as you recruit doctors, then the demand goes up for the facility. Certainly as the population of Edmond expands, we want to be there to grow with that expansion.
So do you think this might go beyond 60 beds at some point?
Very possibly, 20 years from now. You know, my hope would be is that if everything goes well, and certainly as the Edmond community keeps expanding, I would like nothing better than for it to be 10 years from now 100 beds. And if you look over history, certainly at for instance, a Baptist Medical Center, and note how it started and it grew over time, I think you can say, given the right economics, given the right population growth, given the right location, and this is a wonderful location, that certainly is possible.
You talk about why now, and obviously Edmond has a hospital. Most people in Edmond have fairly easy access to, even if the hospital is not in Edmond, to Mercy and other medical facilities.
Well, thank you. That's a very good question. We have historically at Baptist Medical Center had a significant draw from the Edmond community. So we wanted to build on that. We've been talking about this actually for years, but finding the right spot was important, and so we've been looking a long time and thinking about it. So there's nothing particularly magical about this year except that it's all come together, us finding the right partner, finding the right piece of land. The growth of the community is such that we think it can support additional medical facilities, and we certainly hope to pull from north of here as well. We're far enough away from our campus at Baptist Medical Center that we think there's a synergy between the two. So all those things went into the decision that now is the opportune time.
Maybe a question for the mayor perhaps, but would expansion of the frontage road be condition of any approval? I'm assuming you would want more than one lane in each direction.
Obviously, we will discuss that. I don't want to speak how we'll handle that, but we were interested in how the hospital will expand, and we will provide some planning that will permit that, yes.
Can I ask you a question about why you chose this particular piece of property versus some of the others that might be offered?
Well, we looked up. First off, you have to decide in Edmond, did you want to be on I-35 or somewhere else? And so we've had that discussion, and an extensive discussion, and we looked at the demographics through a number of different corridors, entering and exiting Edmond. And our conclusion was, over time, we really needed to be on 35. So then we narrowed our search to 35. Then the question is, how far up north or south on 35 did you want to be? And we looked at properties considerably north of here as well as a few south of here. So this struck us as a reasonable spot in terms of the geography of Edmond. And then I know you're going to get, if you would like, an opportunity to kind of tour the property. You will see that it's very dramatic in its landscape. And I think it provides for us, we're kind of used to building on flat pieces of ground. So this is considerably different. This has a real rolling topography. And we're excited about it because I think we'll be able to do something really very dramatic with the building itself, with great vistas. The land does border on Corps of Engineer land, so we know that it's protected from that standpoint. The mayor has spoken about the city's plans for bikeways and pathways. We think it'll have a real beauty to it that is difficult to achieve in other sites. So we took all that into consideration. That's when we approached Henderson Hills and said, would you be interested in having a conversation with us about us acquiring a part of your land?
You talked a number of times about them being your partner. obviously to be partners in this land deal, but if you want to address this, or somebody from Henderson Hills wants, is there a partnership that's going to go beyond?
Well, I'll just mention a few things. What we have talked about is, as you know, they have a real mission in service, and are involved in a number of activities, as do we. And we just see a synergy. And when we do partnership, we don't necessarily mean it in the formal way, but we mean it in the informal way, with the best sense of us taking our strengths as health providers who have a long history of being out in the community, and the church being very vitally interested in having a long history of service to the poor and others, and us doing what we can to marry those two, and together having a real elegant service level here.
Well, Stan, I agree with all of that. Our church does operate a clinic that we call the Ministries of Jesus Clinic, and this clinic is free, and it really focuses on 3 levels of the human being: the body, the soul, and the spirit. Oftentimes, these levels are segregated, like a college would segregate the math department from the art department. We think since God made us this way, they ought to be put together in one approach. And so for quite a number of years now, we've been involved in providing this free care to people in our community, and they come from a long ways away. What we see here is that this has to be manned by hospital types, and that I mean physicians, nurses volunteer, and we're open always to good partnerships in that way, medical testing and procedures. And so there's quite a number of ways I think that we could work together, and we could provide certainly a spiritual aspect to this process of healing on this hill here that could be helpful for everyone.
So you might refer patients from your Ministries of Jesus Clinic to...
At some times, especially in emergent cases, when there is, they should have gone to the emergency room and we're not equipped for it, we'll send them directly to the emergency room. Or a special test needs to be done that we can't do, we would certainly refer people there. So a number of ways like that we see it working.
I just might mention, we do have a free clinic that Integris operates at the Mount Olivet Baptist Church down near the fairgrounds. And we've done that for 10 plus years. And obviously we uncover lots of pathology in taking care of that population. And we always take care of them. When you have that kind of responsibility, there's always the aftercare, there's surgery that's needed, there's follow-up care, and we've always provided that at our facilities.
Just kind of help me out. Where exactly is the hospital going to be, and how's it going to face? And do you have some thoughts on that yet? Or
well, no, that's yet to be determined. Here's obviously an essential piece of ground, but the facing of the facility, how it will impact the topography is yet to be determined. So I'm just really not prepared to say. It's early on, and we did not, obviously we have a few little issues, not the least of which is the congregation's approval before we start planning the exact placement of the hospital in that property.
And who owns the other piece of land?
The other piece of land is owned by a private party who is, my understanding, supporting this transaction also. He originally sold the property to us, and he retained the right on that sale to buy back the 20 acres, which he exercised, and now is part of this transaction with Integris.